Okay, hi there, it's Dr. Buford. We're just getting started on the right shoulder, looking at from the back to the front. Everything's magnified a bunch, 30 or 40 times on the screen. The biceps tendon's on the left of this gray cannula, and right off the bat we can confirm that this biceps anchor's torn and a problem. You can see how the edge is torn and it's just not stable at all. So that's a slap lesion. We're going to, for you, because we're also concerned about your rotator cuff, we're going to place a spinal needle through. And this will allow us to pass a stitch through the biceps tendon. And the reason I'm doing this is because if we have to repair the rotator cuff, we can incorporate the biceps tenodesis into that. You can see the cuff is torn on the left there. So now, careful here, we're going to take a grasper in the front to Shalisa. Am I saying that right? Yeah. And grasper her in this cannula, and I need the actual shuttle relay. Yep, that one. So the shuttle relay, and then hold this with your left hand, camera. Shuttle relay is going to be a black wire that you'll see come down through the needle. There it is there. We'll go ahead and take our grasper and grab it. We'll back the needle out. Now we're going to take our free hi-fi suture. And we're going to pass that back through the biceps tendon. We're going to do the same thing one more time. So we're going to take the spinal needle back in just a minute. Okay, so here you go there. And now we're going to take the spinal needle one more time. We'll take the grasper again. And then this time, see how I can come through the biceps tendon in a slightly different area. We'll pass a bunch of the relay in this time because we're going to retrieve it behind the biceps. And you'll see why we do that in just a second. But so here we are securing the relay. And I'm going to let go. And I'm going to bring this around behind the biceps just like that. And now this time when I get the relay, it's going to give us a much stronger stitch around the biceps. You'll see that in just a minute. So after we do this, we're going to take a pair of scissors and tenotomize the biceps, which is just a fancy way of saying we're going to cut the biceps. And there we go, pulling the biceps through there. Okay? So hold this right here. Okay, so now we've got the biceps secured. And we're going to release it at its insertion here, way down low. And you can see now the biceps is released. Makes it a little bit easier to see in the joint. I'm going to put the shaver in, and we're going to debride any labrum that looks like it needs our attention. So if you look at this torn edge, we're going to be working along here. Now the main deforming or dislocating force was the biceps tendon here. That was the thing that was causing the labrum to degenerate like this and to tear. And so by removing the biceps from its insertion here, that should go a long way towards taking care of this problem inside the joint. And we typically don't have to do anything else in this part of the shoulder other than make sure the labrum's not going to catch or pinch or click inside the joint. So that's looking pretty good. We'll go ahead and look down the front of the shoulder. Lift up on the shoulder a little bit. And we see some degenerative labral tearing, but nothing that requires any significant surgery in terms of reattaching or anything like that. That all looks pretty good. So we'll sneak around, look towards the back of the shoulder. And look at that. We see a little bit of a condylar injury there that we'll address. See right there in the middle of the screen. We're going to deal with that in a minute. And then, of course, as we look up, we've got this rotator cuff issue right here. So it's essentially a complete tear in the rotator cuff. There's still a little bit of a thread hanging on there. And what I'm going to do is I'm going to pass a marker stitch through there so I can find it very quickly. But in my experience, when somebody continues to have rotator cuff problems and this much of a tear, the smart thing to do so they can get better is to fix it. And that's what we talked about. So that's what we'll do. So we're going to go off in the video and show you some more in a little bit. Okay, so we're in the subacromial space. What we're looking at here, to the right is the front of your shoulder. And as we look to the left, you can see how the bone's pretty flat here. But as we get to the anterior lip of the acromion, it has this downward curve, and that can hurt the rotator cuff. So we're going to start our burr and just level this off. It's actually a pretty quick procedure, as you see. Try and keep it in focus here. We'll stop and take a look. So we're getting there. It's making a lot more space for the rotator cuff, which we like to do, especially after we repair it. Just this anterior lip here. So not only do we want to get all the way to the front, but we want to make sure that we haven't left anything close to the tendon on the lateral aspect either. So lateral would be way over here. So at least in your shoulder, you had a pretty aggressive downslope, and I think that what we did here was a necessary thing to protect the tendon going forward. But just that quickly, now we've got it nice and flat, so I'm happy with the way that looks. Okay, so now we're just cleaning up what we call the bursal tissue. We'll pull this back, just you have to hold it like right there. And what we're doing here is identifying the tear. So we put in that marker stitch right there because we know that right here is where the tendon is torn. And so we can just open this up and expose the tear now. We've already worked on it on the other side a bit, so it shouldn't be very difficult now. And we'll go ahead and put 10 pounds on the white also, which will help us with our exposure. Just changing our traction. Uh-huh. And we know you had an old fracture here, so we have to be mindful of the anatomy as well. Okay, so we'll keep working. I'll show you some more in a minute. Okay, so here's the hole in the tendon. You can see it doesn't quite look like normal anatomy because of the old proximal humerus fracture you had, but we can see where this was damaged. We've taken out some pieces of cartilage that were actually loose up here. And our next job is just to place a suture anchor and then just attach this tendon back down to the tuberosity here. Okay, hold the camera there. So we'll take a spinal needle just to check our angle here. That's not bad, maybe a little bit anterior. Like that a little bit better. So we can place an anchor into the bone right here. I'm pushing on it to make sure it's solid. And it's very solid, so we'll make a little, hold the camera real still, 2 hands. We'll place a little nick in the skin here. And then you'll see our guide come down. So there's our guide. The guide is what we place, let me take it for a minute. The guide is what we place our anchor through. So we're going to place that right about here. Okay, go ahead and hold the camera real still. Mount it. Don't rotate anymore, just kind of hold still right there. Perfect. Okay, just want to get everything lined up so we can see and work. That's pretty good there. We'll hammer this down into the bone. And then once it's seated, we'll unload it. And that gives us 3 nice sutures to work with. We'll have to seat the anchor by pulling back on it a little bit. And that's already pretty solid. So now we're going to work from left to right on the screen. We're going to take out one of the sutures. So I take a crochet hook. We'll take out one of the sutures anteriorly, which is on the right. Looks like we can start with this. Hold the cannula with your left hand. Cannula. And now we're going to use a crescent suture hook coming in from the left. So grasp her to the right. We'll keep working, show us more in a little bit. Okay, so we're just finishing up here, getting a last good look at everything. And we can see the anterior part of the rotator cuff at the bottom of the screen here. You can see the repair there. 3 sutures coming from one anchor, and that looks pretty good. So I'm happy with the way that looks, actually. That actually has brought it together nicely. So I think we're going to finish up here and get you back to the recovery room in just a few minutes, okay? But that's the finish repair. You can see there's 3 sutures. 1, 2, 3. The hole was right there, and now it's all anchored back down to the bone. So good luck to you now. Bye-bye.